All right. All right. How's it going, guys? Dr. Mo here, digital nomad physician at digitalnomadphysician.com. So, as always, you can check out the website for a lot of information. So, most of the information that I have is probably scattered throughout the website at digitalnomadphysician.com. It's on the podcast, and it is here on the YouTube channel. And then there's a little bit of information that I post, mostly share things that I think are valuable to other physicians on LinkedIn. So those are my kind of the articles and posts that I do there. And the Digital Nomad Physician group on LinkedIn is really, for me, it's really good because, it's private. So there's nobody other than physicians on there, so people can share whatever they want. Even though there's good number of physicians on there, I don't think anybody's really comfortable sharing stuff, which makes sense. I think as physicians, we're always very reluctant to kind of be open and vulnerable because there's consequences. There's consequences for that. And I think the system is kind of designed in that way to keep physicians kind of in a tight box. So basically, as far as like what I kind of wanted to talk about today is there's so many people reaching out to me constantly. There are physicians who are trying to start something new. They're kind of burnt out, and it's like, oh my God, I just can't do it anymore. And these physicians sort of just now want to start something when they really need the income. And then there are many other physicians who are reaching out to me kind of very distraught by the most recent, not the most recent, but it's kind of been coming on for a while. But I think more recently, telemedicine companies are kind of coming down hard on physicians who are abroad, meaning they're not probably retaliating in any way, but they're saying, if you're logging in from abroad, we don't want that. Let me close the window. If you're logging in from abroad, we prefer that you just come and do it from the US if you're going to do any kind of telemedicine work, etc. And I think that's understandable because they're trying to mitigate the risk, and the risk is passed down to them by the third-party payers, by the Blue Crosses and Blue Shields and the HMOs and Medicare, Medicaid. So most of us are probably not going to be able to do a lot of that kind of traveling remotely and being able to do telemedicine. It's just something that I've talked about over the past couple of years. I said it's just kind of a matter of time because before the US does that. And I think it's a matter of time before other countries will say that you cannot work remotely doing the kind of job that you cannot be a physician while, for example, living in, let's say, Greece and seeing patients in the US because you are still engaging in the practice of medicine. And even though it's virtual, you can't do it. I think that's still going to be a while before these rules and regulations kind of become more mainstream. And there's always ways around that, which is obviously what this channel is about. I really want to kind of encourage people to stop thinking based on the current rules and regulations, start thinking quite a bit ahead. And that's where kind of this health coaching stuff comes into play. And other physicians have reached out to me, really desperate and really kind of beside themselves and like, I need your help immediately. Well, it's kind of like this. I need your help immediately. I just realized that I just got kicked out of this platform. I've been living in, Turkey for the past 5 years. I'm married, I have kids here, and I've been making all my income from US telemedicine, and I just lost my income. I'm the main breadwinner. I need your help immediately. Oh, sure, I'm happy to help you. You can hop on this call right now. 30 minutes, $250. 1 hour, $600. Oh, no, I didn't want to pay. Sorry, you misunderstood. I didn't want to pay for your service. I just wanted to ask you questions. Sure. And so oftentimes I still answer. I always leave a voicemail. I always provide an answer. I never say no. But it's obviously not the kind of in-depth answer they're looking for. It's a shame because I understand, there's no money. You're afraid of paying for consultation. You're afraid of paying for a service that you're not going to get much out of. Even though all my stuff is 100% money back guarantee, I think people are still worried that maybe they're going to give me their money and I'm not going to give back to them. I think I could see that happening. It'd be really weird. It'd be really odd for somebody to offer you 100% money back guarantee and then not give you the money. I haven't seen that actually happen yet in my own life. But by the time these kind of things happen to us, it's a little bit late. So that's why I've talked about income diversification, everything, spending diversification, income diversification, tax diversification, currency diversification, right? From digital currency to, US dollar to Canadian dollar to Mexican pesos to euros. I think these are the kind of things that many of us have to consider now. And if you still believe that these things are unnecessarily, or they're unnecessary, or they are just being overly cautious, I mean, I invite you to listen to some of the messages that I get from people. There's several people who reached out to me recently with medical board investigations, and essentially, they paid for my consultation. We had a consultation, and they're like, yeah, I don't think it's going to turn into anything big. The medical board said it's not a big deal. And I'm like, well, they may say it's not a big deal, but they've picked up the case, so it kind of seems like it's going to be a big deal. I would recommend this, 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 and this. And they're like, nah, it's not really, I don't really want to do that. I don't really think, And then, of course, 24 hours, 48 hours later, they're like, oh, the medical board's going all out with it. They suspended my license until further notice, and whatever. And so these things are happening. People are losing their jobs. People are losing their state licensure. They're getting investigated by state medical boards. They're losing employment because of, not being a very traditional physician. If you are a very traditional physician, you probably don't have a lot of things to worry about. I agree with that. I think if you're a very standard traditional physician, you don't have a lot to worry about until things happen, like things that are out of your control: major depression, postpartum depression, substance abuse. These are medical conditions, by the way. These have nothing to do with you. These are medical conditions. These will happen to you whether you like it or not. At some point, all of us are going to have depression, insomnia, suicidal thoughts, or whatever. Especially if you're in a high position like we are, burnout, and all these other things. So even for those of you guys, these kind of things can happen. And when you don't have kind of that plan B, you're hit with something, and probably you're going to be okay. Probably everything's going to be fine. But without kind of like a real fallback plan, it's going to be a problem. And if you don't know your resources yet, physicians don't even know their resources, which is shocking to me. Like, there are legal consultants that you don't have to pay them like a $10,000-$20,000 retainer. There are physicians who do what I do. They talk about medical board investigations. They talk about legal issues. They talk about how to deal with a malpractice case. To be honest, I don't really know much about malpractice. Like, if it does happen to me, if I do get a malpractice case, I suspect that I would just hire a good attorney to kind of represent me, but I don't have much information about that. Fortunately, I do have an attorney group on retainer who can recommend all the right attorneys to me. So maybe I am prepared in some way, more than I think I am. But I think these are the kind of resources that we just aren't aware of as physicians, and we really need to. I had some other great discussions. My girlfriend, two of her friends visited us from California. One of them works inpatient, and the other one also works inpatient. I'm so afraid of saying anything more than that, revealing anything more, just because like this day and age, I feel like whatever you say always tends to come back and like bite you in the ass because somebody was upset that you mentioned them or referred to them or something like that. But I don't know. I guess that's kind of the culture that we're. I don't know. That's the kind of culture that we're in. But anyway, these two physicians, they're both in good positions. It seems like neither of them is really. This is interesting. Neither of them is really burnt out, but neither of them really wants to just continue doing what it is that they're doing. They're looking for something else, but they're not burnt out. And then when you ask them, like, do you like what you do? I love what I do. So I think there's this group of physicians who are totally burnt out. Me and my girlfriend, I think, are great examples. And then there's a group that is burnt out and they won't admit it, which is very understandable. And then there's another group who likes what they do, is just bored of it. They just like aren't stimulated by it. They just don't want to do it anymore. And I think that group is probably kind of looking for something different, looking for something in healthcare. One of the physicians, for example, right now, who just messaged me, he's an organ specialist. He specializes in a very particular organ. And he was really interested in data science. And I like what he's thinking about. And probably what I would advise him in the kind of specialty that he is in and the kind of interest that he has in data science, I would recommend to go into two directions. One is you can service the payer, which is the insurance company, the PBM, which is kind of the pharmacy groups, or the hospital groups. That's one direction that you can go. It's probably where the majority of the money will be, and it's the fastest way for you to create a product that you can then sell in that industry. Meaning, if you create a data analytics software, data analytics algorithm, and you can probably sell that for, 20, 30, 40, 50 million, if not more, to somebody in that industry, especially if you're really knowledgeable in the space of organs, as I want to say. Where's my phone? Wait, where's my phone? Damn it. I had all these messages. I was going to read them off to you guys. All right, I don't see my phone anywhere. Where the hell is my phone? All right. Anyway, so for him, I would recommend considering that option. And so one would be, how can we predict where the majority of the spending will be? How can we predict which patients are going to need what medications? How can we, just any kind of prediction that will benefit the pharmacy, the Medicare, the CMS, the Medicaid. And I don't think there's anything wrong with that. I think healthcare is a financial institution. It is meant to suck the most amount of money out of the consumer and give them the least amount possible. From anything like give them a medicine that they don't really need. Look at kind of the history with Zofran and Compazine, right? We basically demonized Compazine and Compazine and Tegretol. What was that other one? I used to always give it in the emergency room. And then all of a sudden, those were dangerous medicines, even though we were using it for decades. And so now it was like Zofran, you have to use Zofran. Zofran's the only safe medicine that you can use. Until, of course, later it's like, Zofran's probably not that good for pregnancy. We should go back to Reglan, And the PBMs were able to really do a great job with that marketing and push the prescription into that direction, not because it was any better for the patient. So the industry is financialized. The industry is designed in that way. And you are forced to be in that industry. It's not like as a physician, your medical license grants you some sort of autonomy. Like if you do prescribe Compazine over Zofran, and God forbid there is some sort of a side effect or something like that, you will be punished accordingly, right? I mean, it is what it is. So, if you stand up to your HMO at Kaiser Permanente and say, well, I realize that you guys are partnering with this, implantable device company just so that you can guys get the best rates, but this is not the best implantable device. I want this implantable device. They're going to say, well, we don't recommend it. And if you keep pushing, they'll fire you, and then they'll make up shit about you, and it will be what it will be. You may not believe that that's the case and that will happen, but there's very intimate experiences on this part of the screen that I can tell you these kind of things do happen. So you can go into that industry. I think there's a lot of money to be made there, even because remember, we're talking about 400 some million Americans. So even saving $1, right? Even saving 50 cents or a penny a year per person can be a huge, huge amount of savings. And often with these kind of algorithms, you can save quite a lot more than that. So I think data science would be interesting in that regard. But another regard that you can really go into if you're interested, but probably will not be very financially lucrative. It will be lucrative, but it won't be very financially lucrative, is going towards the patient side. So really doing the data, doing the NNT, number needed to treat, doing the, what is that other one? All those other values, basically trying to determine if this particular intervention is better than this particular intervention. Is there value to the end consumer? I think then you would have to kind of partner up with some consumer targeting agencies, which even then they're probably often sponsored by pharmaceutical companies or some sort of an industry. But I think that would be also powerful because you could kind of say that like, physical therapy for hip replacement, completely useless. Physical therapy for this, absolutely necessary. Or, pacemaker installation for, I don't know, ejection fraction of less than 30 is probably useful for 1% of people, and in that group, this is the group that is at most likely to benefit from this. So there's a lot of little stuff like that you could, I think, do, especially with this particular physician who reached out to me. I think in his specialty, there is some really, really interesting stuff that I think you can do to try to determine how much the patient can save on certain procedures and things like that. and kind of help the patient predict, like, hey, when am I likely going to suffer this consequence? When will I need this intervention? And what will my life look like? And what will my out-of-pocket expenses be? And if you can demonstrate that to the person visually, maybe what kind of savings you can have from them. So those are the places I would go if you're interested in data science. For other physicians, I've talked about this a lot. I've said that urgent care is alive and well. Walk-in clinics are alive and well. I think this is an incredible time to get back into the urgent care, get back into urgent care medicine, get back into kind of the walk-in clinic for simple, straightforward cases, because oftentimes, if you're part of an insurance group or insurance company, the little thing that you come in with, like, oh, my kid has a little bit of, like, seems like there's something going on with the ear. So all of a sudden, you're part of this insurance group, let's say Cleveland Clinic, or like one of these big name ones. Well, you have good insurance, so the pediatrician is going to refer you to the pediatric ENT, and the ENT is going to refer you to the audiology testing, and they're going to say, oh, there's a little bit of a difference, there's a little bit of an issue, we recommend this, we recommend that, we're going to recommend tympanostomy tubes, and we're going to recommend adenoidectomy, and it just escalates. And so for the simple little thing that you came in for, you were upsold a lot of other stuff. On the contrary, if you have a very simple walk-in clinic and you can charge people cash, simple, no insurance, very straightforward, less than their copay or very equivalent to their copay, you're probably going to save them a lot of money and also save them a lot down the road. And I think data science really comes in, not data science, but maybe data analytics, maybe kind of data modeling comes into play here, because if I can show you that if you go to a big name company, to a big name healthcare system, and you go in for something as simple as sore throat or ear pain or jaw pain, chances are that your future outcome, the average physician will end up paying an extra $3,000, $2,000 for all the unnecessary testing and workup. 1 out of 300 might actually benefit from this excess workup. But if you go to the urgent care, where you're just going to be managed, treated, taken care of without any excess further testing that's going to result in false positives, then you're going to save $3,000. So you paying me $25, you paying me $120, whatever that urgent care fee is, I could save you this much money. And I think that's something that we haven't done yet, that we haven't really shown to the end consumer what they could save by going to this kind of like private cash pay model. And I think that's why the walk-in clinic and the urgent care model, I think these are going to be really, really interesting. And I think major money savers for people in the future, especially for simple stuff. So I do think if you're interested in something like that, consider it. You can have it run by PAs, you can have it run by nurse practitioners, and you can supervise. The key is going to be able to find the right talent. If you look at some of the multi-billionaires these days, they just look for talent, right? They look for some of the best talent that's out there. They hire that person, they snag them up, and they say, you're working for me. A great PA, a great NP, a great pediatric nurse practitioner, put them in your clinic. You open a beautiful, posh clinic for them. Like, where do you want to move? In the US, tell me. I'll pay for the relocation. I'll open this gorgeous clinic for you. You run there, and I'm going to supervise you. We're going to take care of a lot of pediatric kids, and we're going to make it work. It's certainly a good model. It's a good business model. I think the virtual care scene is still huge. You do got to get niche in order to compete. I've said that like a billion times now. If you're interested in perimenopause, menopause, postmenopause, that entire spectrum, I think there's a lot of money to be made there on people who normally would not even get this information, much less be helped. Endometriosis, polycystic ovarian syndrome. If you're an endocrinologist, there's an endocrinologist who reached out to me just recently. Hold on, what is this? Let's get rid of that. If you're an endocrinologist, I highly recommend going into the space of PCOS. I think there are people who are going to pay good money for the fertility aspect of it, for all the other complications that come from PCOS. So that's kind of a bit of a summary of how the kind of people that have reached out to me. The way I'm doing it now is I'm essentially telling people, look, you either got to book a session with me or you got to go into my, 6-month coaching program. If you want, I'm not going to go back and forth with you on multiple emails, multiple messages. What if they do reach out to me on my email or WhatsApp? What I do, I just leave them one voicemail, and then I don't really generally follow up on their reply. And the reason is I don't have the time. And it's not that I don't have the time. I don't want to make the time. As they say, you always have the time. It's just you don't want to make the time. How about other more things that are higher on my totem pole that I want to kind of spend time on? So for those reasons, I just sort of help him a little bit that I can, point him in the right direction, and then kind of let him off. And usually by the time I send back like a reply saying, hey, you can pay for my services, it's going to cost a lot of money, they're like, it's cool, I don't need it. And that's kind of good, because there's just as many people who are really interested in it, and they're like, I'll gladly pay for your time. And if it's not good, sure, I'll ask for the money back. All right, so nobody on the call. That is good. That is great. I have a couple of coaching calls left to do today. And then, these two friends of my girlfriend, we're going to go out to dinner tonight. I'm super excited. Get some good food in Madrid. My hand is, man, it is coming along, but it is, man, it's so bad. Like, look how swollen and thick that wrist is compared to this one, My range of motion is incredible. I can't believe how much range of motion I have. I mean, obviously not as much as this one. Still can't reach that finger, but I'm able to make fists. And then these sutures have been in there now for like over 2 weeks, so they're going to come out next week. As far as the real estate thing, gosh, I highly recommend you guys before you come living abroad, I highly recommend that you get a power of attorney. Have a friend or a family member be your power of attorney. It's a super easy process to do. I really regret not doing it, because there's been so many times that I needed to sign something or have somebody basically sign on my behalf, and it's been just a mess not being able to do that. I'm trying to find basically a notary here in Spain who's a public notary in the US who's going to allow me to sign. That's usually the consulate, and the consulate has no appointments, and I got to close on this deal, this property that I'm purchasing in the US. And so, it's always a mess when it comes to bureaucracy, I suppose. Anyway, guys, if you have any questions, you can certainly send me a WhatsApp message. Go to my website at digitalnomadphysician.com. Bottom right of the screen, you can click and send me a WhatsApp message. Top right of the screen, you can consult with me if you have any questions, any ideas you want to work on. And other than that, that's it. Take care. Have a great day.